My name is Justin Lynn, and I will be doing my presentation over the polycystic kidney disease. This disease has nothing to do with a family member that I've had. I just found it pretty interesting to cover information over, and I hope you guys find it interesting as well. The cause of this disease is genetic. It is passed down from a present family member. This disease causes cysts to grow inside the kidney and on the outside as well, causing the kidney to become larger than normal and damaging the tissue that the kidney is made of. It causes chronic kidney disease and causes 2% of the kidney failures in the USA. I provided you guys with a link below to provide you guys with some more information just in case you wanted some. I'm sorry, my brain is having a couple slow downs. Here's a picture of a normal kidney and a kidney affected by the disease. As you can see that there is cyst on the outside of it, but don't forget that there is cyst on the inside as well. Keep this picture in your head as we go through the presentation just to kind of help you understand what's going on when we specifically talk about things. There are 3 main types of this PKD disease. There is autosomal dominant PKD. You guys will have to bear with me. I don't know if I'm saying these exactly right, so I'm sorry. Autosomal recessive PKD and acquired cystic kidney disease. Some common symptoms of ADPKD include kidney cysts, which you will see in all 3 types of these disease, back and side pain, and headaches. This disease is kind of called is considered the adult disease because it usually develops between the ages of 30 to 40, and it includes abdominal pain, cyst on the kidney, and high kidney volume in its diagnosis. Treatment. The doctors recommend controlling the high blood pressure or making changes to your diet and possibly a kidney transplant if the cysts get too bad on your kidneys. And bear with me, Genarc is a medication that is prescribed to patients with this disease as well. Here are the common symptoms of ARPKD: blood in the urine, abdominal pain, and high blood pressure. This is an important part of chronic disease in children. Diagnosis includes ultrasound possibly showing liver scarring and enlarged kidneys. Symptoms can vary depending on when this first becomes apparent in the patient's life. If it's younger on, it might be worse on them, or if it's later on, the antibiotics might be able to help it better, or it might end up being too late. Symptoms of the ACKD include possible pain and fever. There wasn't a lot I could find on symptoms on this one besides those 2. This one is not like the other 2 diseases in particular. This one really doesn't cause pain. It's actually opposite of it. And the only way that a patient can be able to feel pain from ACKD is if a cyst busts on the liver, which causes the pain, then leads to fever. Age is not a factor with this specific disease. Diagnosis of a person who has been on dialysis for several years a doctor will diagnose this for a person who has been on dialysis for several years and ends up with symptoms such as back pain, fever, or blood in the urine. Stuff that's kind of unusual that the doctors haven't seen and rare. The treatment for this is draining of the cyst, and this is the only one that I found information on that actually would drain the cyst for a treatment. The other ones I didn't find information on that, but like the other diseases, antibiotics can help make the growth of the cyst prolonged and there also can be kidney transplants to help prolong it, and then there's no possible way to stop the cyst from growing, making it no way for there to be a cure. Here's my bibliography for this presentation, and I hope you guys enjoyed it, and I hope you guys are all staying safe. Thank you.